Dr. Christopher Taleghani, neurosurgeon at Maui Brain Spine. We're here today to talk about sacroiliac joint dysfunction. The sacroiliac joint is the joint between your tailbone and your pelvis. It acts as a shock absorber. The spine comes down onto the sacrum, and the sacroiliac joint distributes the weight into your pelvis. It's not supposed to move very much. It actually is tightly controlled by a system of ligaments and muscles. I wasn't trained in residency anything about the SI joint. It was actually after residency, I went to lunch with one of my friends who had left our residency program, finished it, and gone and done a fellowship at the University of Wisconsin. He asked me, he said, do you have these patients where they get referred to you and they have a small disc bulge and they have a little bit of pain in their leg, but mostly their pain's just kind of right here and it's in their low back and their hip? I said, yeah, I got a lot of those people, and yeah, I don't know what to do with them because the primary care doctors and everybody else wants you to operate on their disc herniation, but you don't think it's really pinching a nerve. He said, yeah, those people probably have sacroiliitis. You should look into it. And he told me the workup for sacroiliitis. So I went back to my practice and I started working up people for sacroiliitis. When I see patients in clinic with SI joint dysfunction, almost uniformly people have pain below their belt line. It's usually just a little bit off midline. Associated with that frequently is butt pain, hip pain, groin pain, and even can refer some pain down the leg that is mistaken for sciatica. Frequent causes are falls, accidents, a lot of times after childbirth, if the pain doesn't go away in the back after about 6 months, frequently it can be from sacroiliitis. The SI joint patients generally complain of difficulty with sitting for long periods of time. Going from sitting to standing frequently is difficult. Standing long periods of time, sleeping on that side, frequently getting off the floor and or trying to bend over and pick something up is very difficult for them. When I see SI joint patients in clinic, frequently they've had multiple investigations with MRI, CT scans. They've had physical therapy. They've been seeing multiple doctors, and no one can seem to figure out why they have this lingering pain that's in their back and their buttock. Oftentimes, like I said, in their hips, and can go into their groin. And we basically diagnose them with that and then work on fixing it through a combination of conservative and surgical treatments. When patients have had symptoms over 6 months, when they have the 3 out of 5 provocative maneuvers that are positive and a history that sounds like sacroiliitis, when we've ruled out every other possible cause, and when they've failed conservative therapy, at that point we discuss surgical intervention. I use the iFuse implant system because the SI joint rotates slightly. The iFuse device is triangular, and as soon as you put it in there, it resists that rotation. Over time, each bone grows onto the implant and locks it in place permanently. For about 8 years, I'd walk into the patient's room and I'd say, the good news is I know what's wrong with you. The bad news is there's nothing we can do about it. And then I learned about the iFuse implant system, and suddenly I had something to offer them. And so I began offering to them, and we began fixing them, and I had to actually start with fixing the backlog of people that I had already diagnosed and told there was nothing we could do. And we fixed those people, and they all started to do well, and I've been using it ever since because I've had great results with it. If any of this sounds like you, I'd encourage you to call our office and make an appointment, either in person or via telehealth, or go to our website.